Hello, I'd like to introduce our short speaker, and it's Dr. Sergio Azzolino. Dr. Sergio Azzolino obtained his Doctor of Chiropractic degree from Life Chiropractic College West in 1995, where he graduated salutarian and summa cum laude and received the Clinical Excellence Award from his graduating class. He completed a 3-year postdoctoral neurological course through Logan Chiropractic College and is a certified diplomat of the American Chiropractic Neurology Board. He also holds board certification, diplomat status in pain management through the American Academy of Pain Management. He has blended his background in nutrition with hundreds of hours of advanced postdoctorate training in functional medicine and neuroimmunology studies. He is currently the director of the Azzolino Chiropractic Neurology Group and full-time clinician specializing in the diagnosis, treatment, and rehabilitation of various neurological and musculoskeletal disorders. He has worked with numerous professionals and amateur athletes in their quest to maximize their neuromuscular-skeletal system and assisted in their recovery from injuries. Dr. Azzolino is also an executive director of the Brain Balance Center of San Francisco, a learning center dedicated to assisting children with learning disabilities, autism, ADHD, processing, and various behavioral disorders without the use of drugs. He'll tell you more about what he does, and let's give him a big welcome. Thank you.
Okay, thank you very much. That's what happens when I let Dr. Downs speak to my staff and they pull up some bio from I don't know where. But thank you so much. It's a pleasure to be here. She called me a couple weeks ago and said, "You want to be a short speaker?" And I thought, I've never been that short. I thought I was fairly tall, but I got the idea after she said you have about 30 minutes, so go over everything you can in 30 minutes. So I'll do the best I can to summarize things. Thank you, Dr. Miller. Certainly it's quite intimidating following this brilliant man. As you know, my background's not isolated to neurodegenerative disorders. I have a background in nutrition. You heard chiropractic. I've done thousands of hours in studies in neurology, and we do a lot of neurological rehab. My work with children, I run a completely separate learning center that deals with children that have autism, ADHD, dyslexia, and processing disorders. And our focus there is really identifying the difference between right and left brain imbalances, doing neurocognitive testing. Has nothing to do with chiropractic in there whatsoever. And we devise a program that's designed very specifically to isolate and target their areas of weakness. So we have some great studies coming out with that where we're seeing on the average 2 to 4 grade level changes in children after 12 weeks on objective testing. And so it's proven to be very positive and promising, and most of the work we're looking at there is neuroplasticity. And so we're trying to hit the span, and hopefully we could get together and use this brilliant man's mind to do some more studies and research. So we're going to run right along here, and certainly if you have any questions, I'm here for you, so just interrupt me, please. One thing we do know, as Dr. Miller alluded to, is that inflammation is what drives most neurodegeneration. There's a very intimate interaction between the immune system and the nervous system and vice versa. Certainly there's a lot of studies taking place and we need to learn a lot more, but there are some things that we know that we can do to control the immune system, much of which I think people in this room know a lot about, and that is gut health and whatnot, and we'll run through some of these things briefly. Uncontrolled inflammation is really what is the source of most degenerative diseases that we see nowadays, from musculoskeletal to neurologic. And as you know, if you've been running around in functional medical circles, people were talking about this 20 years ago and were looked at as being nuts, and now the research has finally caught up to its time. So we certainly have a lot of people in this room asking about everything from fluoride to mercury to a lot of these different things. They all have an effect. They all have an effect. Many what we call haptens, the reason why they're so effective is they could actually pierce through our membranes. We have several membranes that are protective in our body, one being the skin, another one being the lung membrane or the barrier system, another being the gut, and another being the brain barrier system. Much research, especially in functional medicine circles, has been looking at the gut barrier, and rightfully so, because this is where a lot of things come in. We also must look at the lung barrier, and beyond that, we are now realizing, and research is catching up to this, that when we affect these two barrier systems, we are in turn triggering an inflammatory response that actually compromises what we call the blood-brain barrier. And this is where we could wreak havoc on things. Certain things such as you were speaking about gluten. Gluten is a protein. I don't think it's evil. I'm Italian. I can't say it's evil, but I have been gluten-free for years. I've raised 2 children gluten-free for 6 years. I personally don't believe it's a great protein. I know Ari Vijdani well, if any of you know him, he had the first patents on food allergy testing way back when. And I could tell you most food allergy testing out there is just poor. And the nice thing is when you speak to Ari, he says, yeah, it's not good. That was my technology. And I just stopped using that 10, 15 years ago. So he is working with a lab called Cyrex Lab now, and that is a lab that I encourage you all to take a look at because they're looking at 12 different proteins associated with gluten. Now, most people are testing one, and I could tell you that I gave him many stool samples and blood samples that he was completely blinded to, and what we saw were that many people that were testing negative in your standard labs from LabCorp and Quest and whatnot were actually showing up positive when you look at the other proteins. The one protein that they're looking at was negative when you look at it in Cyrex. Many of the others were positive. So beyond that, what they identified were that there's various different foods, over 22 different foods that are actually grains and other foods that commonly are confused for gluten. Your body looks at them, it's called molecular mimicry. Their molecular structure looks very similar to gluten. Coffee is one. Unfortunately, and that's my only vice. Coffee, rice, corn, a lot of these things that many of you know, potatoes, they need to be tested also. So we know many of these things can pierce the intestinal barrier, and that's just one example. We develop food allergies commonly because of the leaky gut. Your body starts recognizing these things as foreign. We start to develop these immune abnormalities. These immune abnormalities start to increase what we call your cytokine levels and different interleukin levels, and unfortunately that can pierce your blood-brain barrier, and that's where we start to see some havoc taking place in the barrier, in the brain barrier. Is this a perfect? So we must identify sources of inflammation. If this is too basic for you guys, let me know. If you want to go more in depth, I will. Comprehensive stool analysis is probably the most widely utilized thing in functional medicine. Food sensitivity, chemical intolerance testing, mycotoxin testing. It sounds like someone here likes molds, and you live in Seattle. When are you moving?
I live in Victoria.
Oh, excuse me. Molds can wreak havoc, and they're extremely prevalent. And I encourage all of you, if you're purchasing a home, investigate for the molds. Mycotoxins are the toxins emitted from mold. There's several labs that you could do a urine catch and simply test.
Very quick comment. A third of the houses that I've looked at renting in the Bay Area and about 20% of the ones I've looked at purchasing have mold in them.
So there's 2 camps in mold. Well, let's keep going for just a second here.
It's about mold. And basically, anytime you have landfill, you basically will have mold because it was a swamp. And so you probably have a level of mold in the air just by itself around the swamp.
You can't escape mold. It's everywhere. It's not going to kill us all. Okay? It's just like mushrooms, all right? However, as we start to dive more into the genome, we realize certain genotypes do not tolerate this stuff well. Certain genotypes do not tolerate spirochetes well. So is it all the evil ticks in the world? I personally don't believe so. Is it all the evil mold in the world? No, you have to look at the individual. There's some great people out there. If you have a great interest in mold, I don't know if you've looked at Richie Schumacher's work. He has some good things, and he's really expanded upon that. But We have to be careful because in alternative circles, and my own colleagues are probably the ones most responsible for taking a small bit of information and really running with it, although there may not be a lot of research behind it. So all these things are individual. You could look at what we call polymorphism. Some people have glutathione peroxidase. Everybody knows about glutathione nowadays. You could test a glutathione peroxidase SNP and see if people have an unfavorable gene there or an unfavorable what we call polymorphism on the gene. They're probably not going to respond to the same level of mercury that someone else is going to tolerate. So we don't want to become nuts, if you would, about every toxin in the environment. We want to look at our individual uniqueness and say, okay, what do we need to do to, once again, treat our individual uniqueness? Your question about cancer was a perfect question. We're very fortunate to be in a place in the world where we probably have the best, literally the best of both camps, the alternative people and the people in medicine. I would encourage you to explore both because myself personally, 20 years in practice, I find that a combination of both is the best, not one camp or the other. And nowadays, there's people at UCSF that are very good at mixing those two. There's people in natural health circles that are very good at working integratively with oncologists. And so I would encourage you to do that and be careful with anybody that's trying to steer you in one direction or another because it could be dangerous. You didn't like that, huh? So, inflammatory control, there are numerous different types of herbs and whatnot. These are things I assume most of you know well, so we're going to keep moving along here. Alpha lipoic. Now I have a problem on my hands here because now we know that it may not be beta amyloids. It's the problem. But we do know that alpha lipoic acid does exhibit some anti-beta amyloid activity there. We do know that estrogen does. We do know that these things may have a protective effect from what we understand currently with Alzheimer's. We do know that curcumin has potent anti-inflammatory effects. So with all of these different herbs, I think it's important to really look at your individual needs, and hopefully you're going to catch that's a lot of my philosophy is rather than just taking mega doses of anything. Because mega doses of anything, if you're dealing with an autoimmune response, can drastically shift your immune system in the wrong direction. It may not be the spirochete that brings in the Lymes. It may be your immune reaction to that Lymes, that spirochete, that is what is really the problem. And so if you attack with mega doses of anything, you will shift your immune system. We may not ever get a clear read on what's going to be best for you. Huperzine, another thing that's very protective. We have our green tea right over here. Attenuates beta amyloid. We have DHA that we know can be very effective. The question is, in many natural circles, do we want to be extracting DHA or do we want the whole source? I'm personally a fan of taking the entire fish oil, taking the entire source, and he says no, in an unaltered form.
Lipid oxidation, free radical pathology at Stanford found that it causes immunosuppression and thyroid suppression by taking omega-3s. And look up Ray Pete and Brian Peskin's work.
They didn't look at just that. There was a little more to that study, and we also, I think for the purposes of today, we're going to move on. But I encourage all of you to be careful with any fish oils or any fats that you're taking over the counter because many of them are toxic, they're rancid, and they actually have the complete opposite effect. So, we get patients that come into our office all the time and they say, did you see this? I found it on the internet. And I tell them all the time, it's not that you're better at finding things on the internet than all the other doctors that you see. It's that those companies market to you on the internet because they know if they come to us, we're going to say, well, where are your nutritional assays? Let me see your independent studies, and many of them don't have it. Okay? So we're going to run through some of this stuff here quickly here. Proline-rich polypeptides has shown some interesting changes in amyloid plaquing also. These are a list of different ACH supplements. I'm just running through this. I want to have conversation about some other stuff here because we're going to move along very quickly. Glutathione, very difficult to absorb. In my office we do it intravenously. There's many different new products out there that look very promising. Explore it. Same thing with N-acetylcysteine, carnitine, and whatnot. And we do need to maintain vascular integrity. So, if we look at what your brain truly needs, we know we need three things, and no one could argue this. We know we need oxygenation. Are the studies on exercise looking at just activation of different hormones? No. There's one thing that we do know is that respiratory health is extremely important. And so when we look at a simple thing such as someone's tidal volume, we know that most people's tidal volume is horrible. I got off the phone today with one of the leading, or I should say the leading radiologist that studies what's called thoracic outlet syndrome, where people get compression on their nerves from rounding forward. And it was a conference call with some neurosurgeons, and they just said, well, we noticed that people do not expand their chest wall much, and we have very minimal motion in the chest wall. I disagree 100%. I disagree because I'm a chiropractor, and I told them, and I said, bring in 20 people into my office and we'll manipulate their ribs. And I showed this guy the same thing with moving of the shoulder and the clavicle, and I said we could change their chest expansion by inches, not centimeters, in a short amount of time, just because one of the things, unfortunately, we experience is with time, most of us succumb to poor posture. There's one constant in our life, and it's not taxes, it's not that. Death, yes, but it's gravity. Without gravity, we wouldn't have the brains that we have, because gravity is responsible for loading our joints and muscles, and by loading our joints and muscles, if our brains are not functioning well, our posture is very much a product of our brain, and as we start to round forward, we lose chest wall mechanics. So one thing everybody should be doing are simple breathing exercises, diaphragmatic breathing exercises that are utilized in various exercise circles. Think about what happens, how our body goes through this phase, and we say once an adult, twice a child. Why is that? When we're born, we don't have all of the interconnections of the nerves, and hence we don't have all the pathways developed, and we don't have most of our, what we call human function. We're rounded forward. We barely are controlling our eyes. We're barely controlling our heads. We have no motor control. As we start to get input into our brain and we start to get stimulation into our brain, one of the first things we start to see are eye movements. And then we start to see head movements. Then we start to see reaching and crawling. We start to see the spinal muscles become stronger. This is because our brain is developing. And as we start to come upright, we could take our first couple steps. They look very, what we call ataxic. They look very similar to, unfortunately, what many of us may develop later in life if we have a stroke, if we have a tumor, if we have a head injury, if we develop some demise. What ends up happening throughout our life is as we're getting this input, this stimulation into our brain plasticizes. Everybody familiar with that term? It becomes more efficient. And as we develop efficiency, one of the first things we see develop is good postural tone, and one of the first things we see is a loss of postural tone with time. So I encourage you all to focus on your breathing exercises and just basic diaphragmatic breathing. I'm not going to go all this. It's as simple as possible, but inhaling through your nose, exhaling out, utilizing your diaphragm. You could find this online very easily. You touched on this for me, but I've got a newer study than you. Exercise and brain-derived neurotropic factor. This just came out in 2007. And once again, high-intensity exercise is what we're now looking at as being the most effective with all these different conditions. And it's not exercising for an hour. Too much exercise will increase, somebody was talking about interleukin-6. Too much exercise is going to give you the exact same effect as an inflammatory response. So controlled exercise, high intensity, push-ups, pull-ups, the things that we all learned how to do way back when. It's far better than sitting on a treadmill and watching Oprah for a couple hours, and that's for a variety of different reasons. The brain-derived neurotrophic factor does several things. Helps nerves grow, improves neuron synapses, that's how they communicate with each other. makes neuron synapses and communication more efficiently, reduces neurodegenerative diseases, and supports branching on networks of neurons. Here's a picture of just some nice neural networks, and as we increase stimulation into nerves, whether it's learning Chinese, whether it's exercising, whether it's listening to a lecture, we're going to stimulate and spark new areas. And some of our current thoughts is that stimulation of these nerves actually cause them to branch out and become more efficient, hence the super oversimplified short lecture of neuroplasticity. So exercise protects the brain. This is a recent one, 2012. This is interesting to me because they were saying physical exercise more than mental exercise is showing protection against age-related changes. People who engage in most physical exercise show the least brain shrinkage. The only common thing we're going to encounter in life is gravity. And it's the resistance of gravity that you've heard it over and over again tonight. There is nothing out there that's been proven to be more effective for Parkinson's disease, for cardiovascular disease, for cancer, for age-related dementia, is exercise, people, and we have a very obese and sedentary lifestyle here, so we know we should all be doing more. Exercise promotes brain cell regeneration and production of key chemicals, as we discussed, and very importantly, helps maintain memory, skill task performance, overall cognitive function. I could tell you in 3 years of running our Brain Balance Center, if I took kids in there and only had to do one thing with their behavior, it would be running through what we call our motor sensory room. And that is where they go through some vestibular exercises with the inner ear. They go through some visual processing, some auditory processing exercises. They go through some cross-crawl exercises, and they go through a series of different exercises that are stimulating certain parts of the brain. Now, we put these kids through very standardized tests, and we give them an age level of where they're at. And when all the adults see this, they say, well, boy, I got to do this myself, and it is fun. We give an age level of where they're at because we have some normative data, and then we can design a program very specific to where they're at age-wise. Now, if we look at behavioral disorders to academic disorders, I could tell you from my own clinical experience, there's not the studies to support this yet, I would put these kids through a half an hour of motor sensory training any day before I'd put them through tutoring, before I'd put them through behavioral modification. And why do I think that is? I think it's because when you do the appropriate thing, when you activate the appropriate areas, you're actually making some changes in the brain and having some favorable plastic changes. Another thing here on exercise, mitochondrial biogenesis. You probably all have heard about mitochondria, our energy sources of the cell, and why we want to protect those things. Now, the big difference of what we look at in what we call functional neurological circles is we understand that there's three things. As I said, oxygen. We can make a world of difference with that with exercise and with breathing, and certainly you have to rule out your basic, diseases, as I encourage all of you to do. I will warn you all, I don't know anybody, too many here personally, but I could tell you when you're running alternative circles, you're going to have and be exposed to many things that are decades and decades before their time. Don't be foolish and dismiss what we know from a medical perspective. Don't be foolish and dismiss doing basic testing and blood work that we know is important from a very preventative measure. It happens, and I see it all the time where people say, no, I do things alternatively. Alternative is good, but it's really not alternative when you speak to most of us that do this stuff. We say it's just forward thinking. We just want to do things on a holistic level, but there's other things that we need to address. So we need oxygen. We need fuel delivery. We need to look at everything. Anybody that has diabetes or anything of that sort, it's much more difficult to get well. And we need the most important thing, and that's receptor activation. Gravity loads our joints and muscles. Whether you're thinking about it or not right now, you're getting a great deal of baseline firing up to your brain. Just from the load on your joints and muscles, just from the stretch. We know that when we send our people out to the space station, we need to do things out there, exercises to stimulate their brains. You remember the first pictures when people were coming off the space shuttle and they were holding on? And we thought, geez, we thought they were doing science, and they were up there hitting the tequila bottle, okay? And they came down drunk. They were not getting stimulation to our brain, so we know there are changes that happen in the brain, changes that happen cardiovascularly when we're up there, so we need to do exercises. Our brain is a sensory organ. It's constantly receiving input from our eyes, our ears, and our joints and muscles. When we decrease input from any one of these structures, we can measurably see the change in a lot of these pathways. Unfortunately, it's not always as easy as saying, I didn't move my wrist, and now part of my brain has decayed. No, the lack of movement of the wrist has lots of different effects, and we could see a decrease in the input of these different relays. This is where we run into trouble. When you have increased inflammation that's not regulated, and you have a decrease in the fuel from a lack of nutrients, and another thing I would caution you on is it's usually not because you need to take more of the nutrients, it's usually because you're not absorbing them. So take a look at your mechanisms from your gut health to work with a capable practitioner that knows how to test your absorbability. When you have a decrease in your fuel and your decrease of your activation and increase in inflammation, that is where you start to develop what we call a neurodegenerative condition where the nerves can start to die off. We see this with people after head injuries, very, very common. I work with numerous athletes to people that have had head injuries, and unfortunately, they have a decrease in their function and an increase in irritability of the nerves. Now, understand this is very oversimplified. This is not the technical terms. These are the technical terms, and we'll put those up there for Dr. Miller. So when you have an increase in irritability, what are most people experiencing? They're saying, well, I can't tolerate sound anymore. It's just too hyper. I can't tolerate visual input. I have to wear glasses all the time because this light coming in is just giving me a headache, and on from there. So what ends up happening is these nerves become very fragile, and we need to stabilize them. One of the best way to stabilize nerves is by slowly increasing stimulation into them, because we start to increase stimulation in there and we create some proteins, and that makes the nerve a little more stable. The problem that we have is too much stimulation puts people right over the edge. Why are we talking about this? Because one of the things that we see with decline in our brain is that we need activation, but we don't want to go gonzo. We're going to burn out these nerves. And this is the argument for having a comprehensive examination. One thing we want to look at with a functional neurologic examination is identifying, are there areas of weakness? We're not just looking for muscles that are weak. We're looking at doing a comprehensive history, doing a comprehensive evaluation, checking all the motor sensory aspects and whatnot. And any competent neurologist, as Dr. Miller alluded to, will be able to tell by just how people are interacting in the world how certain parts of their brain are doing. From a rehab perspective, that's important to us. Why? Because we're not going to say, exercise is good, so let's just exercise your brain more. Our focus is identifying exactly where your area of weakness is and saying, let's try to curtail things. Now, admittedly, are there volumes of studies supporting this? No. But we have to get to the moon before we do all the studies. We know that you can change the brain. You can, if you start to learn foreign languages, you're going to have changes in the brain. If you are a cab driver, you're going to have changes in the brain. So, on the same level, we're using that clinically to say, if we identify an area of weakness in your brain, let's have you start doing some very specific exercises for that respective function so that we will hopefully be able to see some favorable plastic changes. We know that one thing that is extremely important are asymmetries in right and left brain. It's very oversimplified, but for the purpose of our discussion tonight, I'm going to leave it that way. We know certain functions in the right brain, which we'll touch on in a moment, have certain effects on the immune system. Certain functions in the left brain have effects on the immune system. But one thing we want to look at is, do people have a right-left brain dominancy? Because what most of us do in life is we continue doing what we're good at. It's not what we should be doing. We should have somebody examine us and say, you know, you're great at this, but you really need to take some public speaking courses. Don't laugh. So we want to identify where our areas of weakness are so that we could focus on that. Most of us have chosen our jobs, chosen our careers according to what we're good at. You know, it's always interesting when we have the autistic child brought in that we know there's some severe right brain deficits by their two engineer parents. And they say, we don't know what went wrong here. And I say, well, don't waste too much time trying to figure out what went wrong, because by the time you figure that out, we may be able to make some favorable changes. We do know that we're going to pass on our genes to our kids, and if we have strong dominancies, they can amplify in the next generation. We want to measure the fatigability and the threshold of neurons. Why? If somebody's very fragile, like I mentioned, the head injury person, we can't stimulate them too much. The key is that if any of us go through a comprehensive assessment, no exercise or no workout curriculum in the gym should be exactly the same, because we're all going to be very different. We're all going to be very unique, and what we want to do is target our areas of weakness. And the focus is really to determine what we need to do rehab-wise. We work a lot with stroke rehab. Dr. Miller's alluding to the right brain. Most people that are not clinicians do not know how to identify a right brain stroke. It's getting better nowadays. Why? Because many of our very tangible things that we attribute in life come from the left brain. Empathy, spatial awareness, a lot of these things that most people can't put their finger on reside in the right brain, and people say, you know, the wife says, he's just different. And she, he's been saying that for years. Or he no longer knows how to get around. These are very difficult things to define. They were at a time. We're getting much better at doing that stuff. So a functional neurologic exam really needs to be all-encompassing of all your sensory nerves, all your motor nerves. We see a variety of different neuropathies. If you're going to look at B12, look at methylmalonic acid. We know it's 10 times more sensitive than B12. We know it's extremely important. There's many different neuropathies that people can have. You need to look at joint position sense. We need to look at all those different aspects. We want to look at balance and coordination. Simple balance tests, feet together, eyes closed, how long you can stand on one leg, one foot in front of the other. All these things are very important, and we know people should be able to do these things for a period of time. We also look beyond that. We utilize computerized posturography, where we look at what's called the limit of stability. We put you on a platform, a sensitive balance platform with a cushion, and we look at what your sway is, and that gives us a predictability of your falling, which is a very high cause of death. Falls are very significant among the elderly. Beyond that, we look at what's called your limit of stability. How far you can move before that foot comes up or you fall. It's very significant. When we look at people rounded, and this was another conversation I was having today on the phone with the neurosurgeon, the radiologist, and the physical therapist. Physical therapist is arguing it's coming from here. The neurosurgeon is saying, we just need to remove this rib. Another chiropractor is saying, we just need to manipulate them. I'm saying, well, hold on a second, guys. Let's take it to the next level. Let's look at what's called their center of gravity. And I could tell you, because we look at this all the time, where that person perceives to be center when they close their eyes is probably back here, so they're compensating by doing this and rounding forward. We see it with Parkinson's. We see it with various age-related dementias and whatnot. And so it's not just a muscular issue, it's a brain issue. And one thing we can do with these things is we could actually work people and rehab them by having checkerboards on the screen where we're moving people around to target those areas with their body, possibly while they're wearing some glasses that are certain colors that we know affect one part of their brain. We could take what's called a hemifield stimulation. You remember these, and this is give you an idea on how some of our crazy colleagues work. This is a alternating checkerboard that's used and was used. Are you guys using that much now? Well, we have some colleagues that had taken that program, manipulated it. We could change the colors, the speed of the checks, the size of the checks. We could put it in different fields, and depending on what one has, we may put it up in a corner of a field while they're doing a balancing exercise. And the nice thing is we can see some very, very objective changes in their posture and their limit of stability and their center of gravity. We do ocular testing. This is what we call a VNG, a video nystagmography, and I'll have some resources for you guys on this where it's a great test that I think everybody should have personally. We could put you in a chair, put some goggles on you, take away your visual reference and actually spin you, and we could measure how your vestibular system and your inner ear is processing movement, and we in turn have a measurement to see how your eyes are moving. You're going to like this. One of our colleagues just purchased all of the intellectual properties from Epley. So it's going to be in the Carrick Institutes. It's going to take off. So we now have the ability to really, and John Epley is aboard, so we could really investigate this stuff. Great. So the vestibular ocular response is great to look at because it helps us with our awareness of where we are in space. We're never perfectly still. Never perfectly still at all. This was discovered long ago with a physician that had a stroke, and the only way he could read was putting his head between the boards on the bed because of slight movement in his head, which they thought was from the beating of the heart, was making his world do this. So when we identify someone that has a poor vestibular ocular response with balance and coordination, you could do exercises, everything from spinning. Occupational therapists have been doing spinning exercises. The big problem that we have is that rarely do people need to spin around both directions. Usually it's very isolated in one direction or another. Saccades are your eyes moving quickly. And we know that with many of these disorders, there is an increased latency or a slowing of your saccadic movements. We know that after a head injury and you walk into a room, your tracking of things in that room have changed. We know that the advertising industry knows this well, and they know where to place things on the shelf. So it's very beneficial to identify what your saccadic latency is, where your areas of weakness are, because something as simple as doing an exercise with moving your eyes, once again, we see an improvement in the latency. We see an improvement in the speed. What does that mean to the brain? We have to investigate it further. We don't know, but we do see an improvement. Just like you go to the gym and you work out your biceps, we're going to see improvements in that bicep. What does that mean to everything else? Well, there's more research on exercise than there is on the brain right now. Optokinetic activity, when you look out at the cars passing by and the cars are going by you like this, there's a tremendous amount of stimulation to your brain. Your brain should be able to attenuate that stimulation, should be able to calm down that stimulation so it doesn't give you the illusion of movement. It's happened to all of us, right? One time or another. You look in the car, you start backing up, and you think, was I moving? No, it was the other car moving. All right? You're on a train and you see this. Unfortunately, people that have a poor mechanism here, which we see decline with age, can no longer tolerate the ceiling fans. Well, why aren't you driving on the freeway anymore? Well, those oncoming cars are just too much for me. We could give somebody as simple as a ribbon with a red and white checkerboard stripe on there and have them do exercises in one direction or another, in one plane or another, and see improvements in their optokinetic stimulation. Once again, clinically. Have I seen it? Seen it thousands of times. People can now tolerate the ceiling fans. They can tolerate driving. Very, very important stuff that needs to be investigated further. Auditory processing, we utilize some great things called dichotic listening, and we could hear if people are hearing things from one side or another over and over, and Merznick, as you know, did a lot with this. Visual processing, very important. It's not just your eyes, it's how your brain is processing vision, and many people have some difficulty with this. Physiological blind spots, we all have blind spots. Some of us argue that others are bigger than ours. Okay, we all have them. We could map them. And my mentor, Dr. Ted Carrick, did his dissertation on this and looked at the physiological implications of learning according to blind spots. Because we know nobody in this room is going to agree with what was taught tonight, right? We're all going to have a little different spin. Why? Because our brains are different. In our blind spot, we have a little part in our eye that doesn't have receptors in there. So we all have a small blind spot. It should be about the size of the dime. Many times people's blind spots enlarge following a head injury, following a trauma, or just with age-related decline, we start to see enlarged blind spots. They can change instantaneously with stimulation if the stimulation is directed appropriately. So when we look at brain exercises, there's a variety of them to do. The key is not just going crazy and trying to do as many as possible. You're probably going to cause a stroke more than you're going to help. The key is really identifying where your area of weakness is and focusing on that. 2 minutes, so we're going to move. So here's something on neuroplasticity from Dr. Mersnich, as we were mentioning earlier. It's the exact stimulus delivered in the appropriate sequence with precise timing. The training must be intensive, repetitive, and progressively challenging. You could apply that to the body. You could apply it to the brain. When people say, I've had the same gym routine for 30 years, you say, I know, that's why you still look the same. Okay? We shouldn't be doing the same thing with our brains either. We should be challenging ourselves, learning new things. And the fact that most of you are here means that you probably already have better brains, because who wants to do this on a Thursday night, right? Smart. Smart on all of you. Now, 30 seconds on this. Cortical asymmetries, imbalances in the brain can actually lead to everything from an imbalance in your natural killer cells, an imbalance in how your spleen and your thymus affect things. We know that the left brain is really the motivator of things. It motivates us to go out into the world. It motivates us to have what we call approach behavior early on in life, and it also stimulates our immune system. The right brain puts the brakes on things. It inhibits things. When we see people with a poor right brain, they can't inhibit things. They're impulsive. They're doing things that are not socially appropriate, and they're not able to contain their immune system. So we want to look at many immune dysregulatory functions. We want to not just look at them as an immune process, but look at the brain and how the brain is regulating the immune system. I'm going to show you just some basic things on right and left brain here that may be a benefit. If you guys want, I could provide you lists of these things here. This comes right out of a colleague's book called Disconnected Kids that looks at imbalances in the hemispheres and how it leads to many different things. This is when the right hemisphere is underactive. This looks at when the left hemisphere is underactive. These are things that we utilize in our Brain Balance Center because many parents bring their kids and say, my kid's having academic problems. What does that mean? We want to break down those academic problems just like we want to do later in life when someone's having difficulty, and break it down and see exactly what it is, where the area of the brain is, and then we could give some specific guidance. So here are some resources for you. If you want more information, and I will certainly be happy to pass them through Dr. Susan Downs, and I want to thank you for your attention. I certainly have a couple minutes for question and answer.